introduction, and I'm just really happy to be here celebrating FD with all of you. Besides working on this disease, I'm also a cousin of two people that had FD, and it's a disease I care a lot about. So today, I'm going to talk about two things. One, very quickly, talk about what's going on in the gut in FD and in metabolism in FD. And this photograph here, which was taken by my lab, shows some of the neurons in the gut of a mouse, but our gut would look very much the same. And the other big question we've been working on is means for minimizing the blindness that often happens in FD, and as Dr. Kaufman introduced. Okay, so first I'm going to talk about our work on the gut, the GI tract, and metabolism in FD. And as you probably have heard, there's extensive communication between the gut and the brain. And so the gut is full of neurons. It's also innervated by neurons from the brain and other regions of the peripheral nervous system. And the gut is also full of bacteria, trillions of bacteria. And those bacteria and the neurons in the gut and the other cells in the gut and the brain all communicate with one another. And if that communication goes awry, then there are problems with bowel movements, constipation, diarrhea, and all of this whole axis between the gut and the brain also affects the liver, and the liver is the regulator of metabolism. And so if this circuit is dysfunctional, there's also going to be metabolic problems and nutritional deficits. And of course, all of these things also affect mood and can cause stress and anxiety. So we've been collaborating with the center at NYU and two other fellow labs at MSU, Seth Walk's lab and Valerie Copier's lab. And we have received very kindly from all of you, many of you, stool samples and serum blood samples. And we've been analyzing the microbiome, which is just the complete set of bacteria in your gut. And by looking at the stool and also analyzing metabolites in your blood and in the stool. And we find significant differences between the pattern of bacteria in the gut of people with FD versus relatives. And we see differences in metabolites as well. And the differences in metabolites indicate that there's some energetic stress happening in people with FD. So there's problem making enough energy. And so as a result, proteins and other metabolites are being broken down in an attempt to make more energy. We also find that the normal pattern of bacteria that are typically associated with health are often less abundant in people, in the stool samples from people with FD. We also, as Dr. Kaufman mentioned, we have mouse models for FD, and we can recapitulate many of these same effects in our mouse models, which then lets us, we have a system then, a platform for testing potential therapeutic strategies. We also find, interestingly, that if we co-house our mice with FD with mice that don't have FD, that the overall gut transit time, so the movement of stool through the gut improves, and the overall health of the mice also improves. And this is the result of something that sounds a little icky. It's called coprophagy, but the mice eat each other's stool. So we will be, these results are have been submitted for publication now. We're waiting to get them published. And we are planning to work with Dr. Kaufman and Dr. Duarte to discuss all of these findings. They're of course involved with this work, and to discuss, how to translate these findings to therapeutics. The other major project we're working on is, as Dr. Kaufman introduced, gene therapy, where you introduce a healthy copy of the ELP1 gene. You put it into a virus, and you then can inject that into the eye. Now, gene therapy could be used, as Dr. Kaufman said, you know, it could be used to do a systemic delivery, but we thought it was worth, for many reasons, starting with the eye and seeing if we could prevent death of neurons in the retina. And through very generous funding from Paul Wexler family and from the Dysautonomia Foundation, we are now making a vector based on the positive findings so far we're finding in mice. We're making a vector that actually could be used in humans. And I should say that this work has all been done also in collaboration with Dr. Claudio Punzo at UMass Medical School, who has considerable expertise in this area. We also are collaborating with Dr. Sue Slagenhaupt and Dr. Elisabetta Marini at MGH at Harvard. And as Dr. Kaufman introduced, they have been working with these small molecules with a company, PTC, that improves splicing. And so it's another approach for elevating levels of ELP1, which is the protein that's reduced in FD. And so in collaboration, we've made it our mice, the Montana mice to the Harvard mice. And so we have this hybrid model that then we can test both of our therapeutics in. And we've shown that their splicing compound also works well to prevent the death of the neurons in the retina that normally die in FD. And now we're doing one last experiment together where we're going to combine both the gene therapy and the PTC splicing molecule and see if the combination of the two would be even more effective at preventing death of neurons in FD. And so that's it. I really need to thank all the wonderful people who do this work and have supported our work, the wonderful people in my lab and my collaborators at MSU, Claudio Punzo at UMass, the people in the Dysautonomia Center, and of course, Sue and Elisabetta at Harvard. And I want to thank the NIH for supporting this work, Paul Wexler family, and the Dysautonomia Foundation. So thank you very much.
Thank you, Frances. That was fascinating, keeping up our rate. Now we're going to go over to Professor Sue Slagenhaupt, who you all know. She's the scientific director at Mass General Research Institute, and she's dedicated much of her professional life to the understanding and research of dysautonomia, including the discovery of the gene. So she's going to share with us some updates on FD research in her lab, which we're all eager to hear about. So over to you, Sue.
Thank you so much, Adrian. Get the slides up. Can you see this fine? Yes? Yes. Hi, everyone. It's so great to be here. I'm trying to, we can't answer the polls as panelists, but I was trying to think how many years I've been coming to FD Day, and I think it's close to 30 years almost that I've been with you at FD Day. So here I am back again. This slide just shows my FD team at the Center for Genomic Medicine at Mass General Hospital. And I just want to point out these people because they're so important to all of the work that we do. Anil is a retinal specialist. He's a junior faculty member. Ricardo and Daddy are bioinformaticians, and they do a lot of work looking at big data that we generate, looking at the expression of the gene that causes FD in different tissues. This is Emily and Jess, just left our lab to go to medical school. So hopefully she'll continue her interest in working on FD. Emily will be headed there soon. And this is Dr. Elisabetta Marini. She's also a junior faculty member in the lab, who you heard Frances mention. And she's a driving force behind much of the work that goes on FD. So as Horatio mentioned to you, what my lab has really been focused on is to correct the defective splicing And we started this work with the goal of developing a drug or a small molecule in order to correct the splicing in FD. And so, you've heard this for many, many years. I know you're all experts on this. What we're trying to achieve is in the normal case, exon 19 joins to exon 20 and exon 21 in the ELP1 gene, which gives us protein that works. When exon 20 is skipped, we have this mutant message and no ELP1 protein is made. And so the issue in FD is we have the skipping of this exon and we don't have enough ELP1. And so our goal is to develop a drug that could tell this gene to assemble properly. And that's what we've been working on. So our goal is to increase the amount of ELP1. So in addition to many other studies we have going on, we have worked with our starting molecule, which was kinetin that you've been hearing about. We found this, I think, in 2004 or 2005. It's a natural compound, but kinetin wasn't a good drug, as I've told you about many years. And so we worked through funding with the NIH to improve kinetin, which we did significantly, which brought us to this compound. And then we formed a partnership with PTC Therapeutics, and we developed 2 additional compounds, and we now have potency that's improved over 100,000 times. And PTC worked with us from about 2015 through 2019. They had a clinical development program that was designed to take one of these drugs to the clinic for FD. Now, unfortunately, for very many reasons, they canceled their clinical development project in 2019, which I've told you about. However, they've remained excellent partners to us and have continued to try to help us figure out a way to get one of these drugs into patients with FD. So we've spent the last year working a lot on this drug, PTC 258, trying to figure out if we had a way that we could get this drug into patients. It turns out we just got some results recently that we can't. There's just not a big enough safety window. And so now we're focused on this drug, PTC 680. And so we're working to find funding to perform the necessary testing. When you have a drug like this, there's a significant amount of testing that needs to happen on this drug before we can give it to FD patients. This is true for any drug. The issue is that we are working on FD and we don't have a large company behind us. So we are in negotiations with NIH to see if we can get them to pay for some of the testing that needs to happen on PTC 680 so we can get it to the clinic. Our goal with this is that we will develop an oral drug that gets to the brain and all tissues in the body. So this would be a drug that could either, you could swallow or it could go in the G tube and it would get to all tissues in the body, including the brain. And we've done a lot of work on both of these drugs in our mice. And as you heard Horatio say, we know that they correct splicing, they improve the gait, they improve the number of neurons that are in the dorsal root ganglia and other critical areas, and they improve the retinas. And prevent the retinal degeneration that we see in FD. So we're very excited about these. And I've told you for a long time, we're continuing to work. This is not an easy process to identify funding to get a drug into patients for an extremely rare orphan disease, but we're dedicated to continuing the work on this. So in addition, you heard a little bit about the work that we're doing collaboratively. I want to stress how much of a team effort this is among everyone that you're seeing today. So whether they're the clinical researchers at the center or in Israel, and the fundamental scientists that are working in Francis's lab and in my lab and others, we're all working together, and we do talk and collaborate a lot together to figure out the best path. We're trying to we're pushing on multiple fronts to try to get some treatment to the FD patients. And what I want you to know is it doesn't matter to us which one gets there first. We're pushing them all so that we can get a treatment to the FD patients. So we work with Francis's lab on the gene therapy and other new ways to treat FD. We're continuing to test different therapies that both prevent the retinal degeneration and improve gait in our mice. And as I mentioned, we're working to find funding to do the testing necessary to get PTC 680 to the clinic. So thank you. And I'm really pleased to be here with you, and just know that we're continuing to work as hard as we can to move these therapies forward.
So thank you, Sue. That's really very exciting. There we go. Put my video on. So thank you very much, Sue. That's a fascinating update. We'll come back to, maybe there's some questions now popping up in the chat or in the Q&A, which we'll come back to when we're in the panel. I'd now like to introduce Dr. Bat El Bar, who is my daughter's Tamar's doctor from Sheba Tel HaShomer Medical Center here in Israel. Bat is a pediatric pulmonologist who's the senior treating physician for FD at our FD treatment center. And over to you, Bat.
Hi, everyone. Very glad and excited to be here. I have 2 minutes, so I'll talk about 2 projects that are going on here in Sheba Medical Center. Horatio mentioned them in 2 words, but I'll take my time to elaborate a little more about them. So first, we have started a trial in Israel with Professor Miguel Weil from the Tel Aviv University, who works also with Be'er Sheva University. We started collecting skin biopsy from FD patients and family members. I'm taking the biopsy. Until now, there are no complaints. So then I give them to Miguel. He takes the fibroblasts in the skin, and those are being reprogrammed back into embryonic-like pluripotent state. These are called induced pluripotent stem cells. Then they are directed to develop into functional neurons. And the next step, that these neurons will be tested with more than 6,000 compounds that are all FDA approved, hopefully to find new compounds that we don't know yet. And they will be studied further to see if they can improve neuron function and survival. Till now, we have collected 4 samples. We have a grant for 20, so I think we'll get there soon. The second project that I want to mention is in the past year, with the help of Adrian, we recruited a brilliant researcher named Monique, who is now retired and spends time with her family. But once a week, she volunteers and comes to our medical center and feeds all the data that we have on patients to the software of the natural history study. And till now, all patients that signed the consent form are already in the database, which is very exciting. And of course, more to come. So thank you all for listening. Bye.